Well, good morning. So glad to meet you. I usually like to spend a moment just describing a little bit about why varicose veins develop and spider veins. And I think if we do that, it'll help you understand uh, why they look the way they do and also why they're treated as they are and also why they cause symptoms as they do. Typically, and then let's assume that you've got varicose or spider veins or both. If you have these develop primarily because of a genetic trait. We know that because if we follow this off from you to your children, there's about a 40% transmission rate. In other words, a 40% chance that they're going to show up with either varicose or spider veins during the course of their lives. Now, if both parents have them, both you and your spouse, that likelihood rises from 40% to 80%. So this just shows how strong this runs in families. Though it is true, like myself, who've had varicose veins, about 15% of us who have varicose veins don't know anybody in the family who's got them. So it came somewhere down that family lineage that we just don't know. But this trait affects the valves within veins. Now, in our circulation, there are actually two sides. We all realize that our heart is pumping the blood into the arteries, right? But the veins, the primary pump is not your heart, it's primarily your calf muscles. Every step you take as you walk, your calves actually squeeze veins and massage them. And this is what's actually pushing the blood up the leg, not your heart. And inside the veins, unlike arteries, you have one-way valves. These valves are pushed open as your calf pushes the blood past them. And after the blood slips past, the valves close behind the blood, and the blood settles on the valves and is supported by it until you take your next step. When you do, it gets pushed up higher to the next set of valves. And this is repeated from one valve to the next all the way up to your heart. So again, while your heart pumps the blood into your arteries, your calves are the primary pump of the veins. And the valves in the veins ensure that that blood always moves up your legs against gravity. Now, when we're standing or sitting still, as I'm sitting here now, all the valves within the veins of the legs are actually closed, and there are literally hundreds of these in all the veins, nearly all of them. And the blood's resting in all those valves waiting for us to take the next step. And this includes from the very largest veins to smallest veins that are only visible with electron microscopy. However, in varicose veins and spider veins, those vein valves at this moment will be giving way under the weight of the blood. This genetic trait has caused those valves to weaken, and in those veins, blood is slowly trickling back down the legs with gravity. Now, that backward flow in some patients that have huge bulging veins, they can actually observe it, because if they wake in the mornings while they've been laying down all night, they'll notice that the bulges seem a lot smaller. But no sooner do they arise, they'll see the veins start to distend as blood begins to back down and fill the veins. And typically by the end of the day, it's a little bit worse. Well, that backward flow actually starts in many years before you ever see them. It probably begins around puberty. As a matter of fact, there have been recent studies showing that if you did ultrasounds of 8-year-old children, you could actually see the blood trickling back down these veins. And for years, it's completely invisible, and you're unaware of it. You don't see it, you don't feel it. But over time, because veins are elastic, the downward flow begins to distend them, stretching them out like a water balloon. And they finally get large enough that you can begin to see the veins and then feel them. So if you're having backward flow down some of those small little veins, the tiniest ones, the backward flow develops the appearance of the teeny tiny spider veins, little blue-red fine veins in the legs. If you're having backward flow down some of the larger veins, you can develop the appearance of very large bulging veins. And there's also other veins, sometimes large veins that are deeper in the skin that you never see. As a matter of fact, most of the veins that are failed are not seen. So this is how they develop, and this accounts for why they look the way they do. Now, symptoms that will accompany the veins are sometimes very vague. Aching, cramping, restlessness, itching, burning, kind of a heavy sensation, fatigue in the legs. These are some of the most common symptoms. When veins cause these, it's because the veins have been distended by the backward flow. And our body can actually sense that the pressure has been elevated. And in response to that, our body begins to send white blood cells out to the vein wall. It's as if a red flag went off, or an alarm, and your body is thinking there could be something's wrong out here. There could be a cut out here. There might be an infection or something. And so your body sends the white blood cells there. Now once it arrives there, it turns out it's a false alarm. But your body says, I don't care, something's not right. The pressure remains high, so the white cells remain there. And they line up along the vein walls, much like the troops on the Korean border. Well, these white cells can actually infiltrate the vein wall and inflame them. And it appears to be the inflammation of the veins is what's responsible for the symptoms, though people will vary a great deal in how they experience. The common denominator is they're inflamed, and that is a response to the high pressure. Well, in some patients, the inflammation can affect not only the veins and symptoms in the legs, but can affect the skin over the veins, so they get redness, or they can actually, in some patients, get darkening and discoloration of the leg, and in the most severe cases, ulcers. We treat varicose veins primarily, number one, to make the legs feel better. We know veins cause symptoms because when you treat them, typically you can tell a difference. We also treat them because they look that way. And it can affect your lifestyle where you won't go out, and when most people will be wearing shorts or skirts, you don't do that, or you don't even participate in the activity at all. And finally, we treat veins to keep it from slowly progressing. Vein disease is never static. It's always moving on. It starts in before you notice anything, and then once you do see or feel them, it slowly progresses. And that's because gravity is always acting on the blood within the veins, and the veins, being distensible as they are, stretch out and symptoms progress. If we treat veins, we treat them then to make them feel better, to make them look better, and to keep it from progressing. And we treat veins not by repairing them, but by eliminating them. And that's because the blood in these veins is actually going the wrong direction. And these veins, while there's blood in them, they're not actually circulating the blood. In a normal vein, if you can imagine, the blood always moves in one direction, up the vein, past the valves, towards your heart. But in a varicose vein, if you take a step, blood will move up, but then the valves give way, so it falls back down again. You take another step, it moves up, and then it falls back down. So the blood in a varicose or a spider vein is actually just kind of churning there. So these veins, while they're storing blood now, they're no longer circulating it. And for that reason, your body never notices when they're gone. They represent a very small percentage in most patients. Even those with the largest varicose veins, these typically represent less than about 5% of the total venous return coming up the leg. And that's because the deep veins, which carry over 90% of the flow, are deep down inside muscle and are much less prone to have this problem develop. And there are a number of reasons for that. But in any event, when these veins fail, it's typically a small percentage, and your body actually has ceased to use them. You have more veins in your legs than you ever really actually use. You're built with a reserve. The same is true for other bodily systems like our renal system, that you have 2 kidneys, and while those are vital organs, yet most healthy persons can actually donate one of them to a family member, which raises the question, well, if you really only needed one, why do you have 2? Well, it's because you're designed with reserve. The same is true of veins. Veins are elastic. That's part of the way they serve their function. They're supposed to hold blood. During pregnancy, one of the reasons that women's varicose veins get so much worse is because during pregnancy the blood volume increases 40%. And that's to supply the baby and the placenta. And it's all stored in those veins. And so they stretch way out tight. And if you already have that genetic trait where veins are tending to fail, that tends to be a time that really tips them over and that starts to really show up in their legs. So again, storing blood is a normal part of the veins, and they're distensible for that reason, but that's also part of the reason why they tend to fail. And when they fail, your body ceases to use them. There's blood in them, but the blood's not circulating. And when those veins are gotten rid of, your body never notices their loss. Patients oftentimes will ask me, if you get rid of them, does your body have to find another route to get the blood up the leg? And the answer is, well, actually, no, it's already doing that. It's just as if you were on Kingston Pike and the traffic was backed all up. He says, well, I'm not staying here. I'm getting off the road and making my way around. Your body's encountering this backward flow, blood backing down the vein. It's already rerouting it. So your body never notices when they're gone. So we treat veins to make them feel better, to make them look better, and to keep it from slowly getting worse. And we treat veins not by repairing them, but by eliminating them. I hope that's been helpful.